My name is Mercedes Ferris. I was diagnosed with DCIS at the age of 44, 2016 in December. And it was a long journey back and forth, trying to figure out a lot of things as this was my second round. So trying to understand what was going on again in my life. So this was a time of my life where I was trying to get the right type of work done and not knowing exactly which path to take. When I first met Dr. Fisher, I was so relieved to find someone that was, I'm a very visual person. And with her, what she was able to do to draw things out for me and explain everything on her little drawing board did a lot for me personally, just because I need to see things. You can explain something a million times, and especially the amount of work that I needed to have done to be able to see it really helped me, and that also made me feel more comfortable to be able to really visualize what was going to happen to me and not see it on YouTube, but actually have the doctor draw it out for me and see what was going to be the phases of the procedure. That helped a lot. I had what we said deflapped, where I had a double mastectomy, and we did the reconstruction where they moved the belly fat into making brand new breasts. So it was a process of having a complete tummy tuck, if you will, but also transferring fat from my abdominal area into my breast. So the amount of work that took was very complex, and I felt very comfortable knowing that the outcome was going to be something I'll be happy with.
So your diagnosis was ductal carcinoma in situ, or DCIS, a non-invasive breast cancer, and you planned a bilateral mastectomy. Tell me how you decided to have a nipple sparing. What was the decision process to decide to have a nipple sparing mastectomy?
Since we feel that we've caught the cancer early enough that I didn't have to do a complete mastectomy, it was something that I thought I wanted to do. I don't know. Again, I know if it would have been further along, it probably would have to have done the whole and no nipple sparing, but I know it was newer technology. It was a newer thing to do. And I was willing to take that risk to be able to keep my nipples and just to have the full look of still having my breasts. So it was a thought process, because it did stay in my mind. What if it was in my actually nipple, or the duct of my nipple, or anything along those lines? But I know we did a lot of extensive tests, and it came back that I was a candidate for it. So I was really pleased to know that I was a good candidate to keep my overall look of my breasts.
Your breasts look completely natural. Have you seen other doctors who are not involved in breast cancer care? Have you had a primary care visit, or had any opportunity for someone who's not familiar with Reconstruction to comment on your appearance?
I did, and this is actually kind of funny. So one of my good friends, her husband does anesthesiology. He's an anesthesiologist, but he lives in San Antonio. And when I told him what was going on, he's like, I would love to see them, because he's on a medical perspective. I just want to see what they look like. Mm-hmm. And of course, I'm proud of them. And so I showed, and he was just taken back. He's like, that's meticulous work. So I was really proud to know that another person in the medical field saw them and was expecting something totally different. And then when he saw them, he was really thinking what they was excellent work.
Oh, that's great.
I did. I was very proud.
I've had a few patients tell me that they were at their primary care or their gynecology visit, and that they said that can't be a mastectomy, and that's really from a provider. That's really fun to hear a story where a patient looks so natural.
Yeah.
That they don't look like they had a mastectomy. I'm always hopeful for a result like that if we can get one.
Well, the best children are very honest. And I don't know if I told you, my daughter,
Wait, what is her age?
She's 10.
10, okay.
My 10-year-old daughter saw my breasts after surgery. I mean, it was fresh surgery, so you would think that's the worst time because everything is still swollen. She walks in, she sees me, and she says, "Mommy, I thought you were gonna get them removed." So, and I said, "I did, but these are new." And she just didn't. In her mind, they still looked
Same.
natural, so she didn't register that they were now the new hair.
She's like, they forgot to do the mastectomy.
Well, she's like, "Mommy, I thought they were going to take your breasts." And I'm like, "They did, but they were able to do, it's called I was trying to explain to her the procedure. And of course it went over her head.
Well, the breast skin, in your case, didn't have the disease.
No.
So we were able to keep the outer covering of the breast and just remove that pillow of gland from inside. Mm-hmm. And then when we replaced it with the tummy tissue, your breasts look natural.
They look very natural.
And your incisions along the fold, and so you really can't see any signs that you had a mastectomy.
No, none at all.
It's just great.
It's really great. And it's, if anyone who's looking to have that opportunity to do that, I'd strongly recommend doing that. It was a process, but as in anything, but overall the results are amazing.
In my practice, more than half my patients are reconstructive, and it's really a focus and a core part of the practice. And every patient that we care for, I feel we should try to optimize the aesthetic result, that there really is no difference in the expectations between a breast cancer patient or a cosmetic patient. Everybody safely wants the best result they can get. And so in my practice, the artistic aspect of the result, I think, really differentiates the patient's outcomes from what other standard reconstructive methods might give.
My original concerns, mind you, that I did not have to go through chemo nor radiation. My original concerns were, am I going to go, after I go through all this, will I have a decent size? So it's in
the cosmetic result. Right?
The cosmetic result was overall my concern, and with Dr. Fisher, she was able to give me a decent size of the results that actually superseded what I expected.
What is the cup size that you would say you are now?
I am a C now. Originally, we were thinking I was going to be a B. But with enough eating,
but you wanted a C cup.
I wanted a C cup, but we weren't sure because I didn't have enough belly fat. So I was able to eat enough to.
Well, we also had one touch-up session, right?
We did have one touch-up session, but before that, I still had the C. Mm-hmm. So I had the C, and then we did one last touch-up this past December. Mm-hmm. So the past December was to fill in just final touches. Mm-hmm. After the swelling and everything went down, we had one touch-up, and we're good. I don't need any more.
I'm so glad that you're happy.
I am. I'm really happy. Thank you.
You're welcome. I'd love to take care of you. I appreciate that you let me be your doctor. It's really good.
Every interaction with Dr. Fisher has been actually coming to meet with a friend. She's very welcoming. She's always has a great smile on her face, and she's just a genuinely good person. You feel that as soon as you walk in and you meet her. That is something that I didn't feel a lot of that with the numerous other doctors that I met with. So that's something to me was part of the selling, of feeling comfortable, of having her work on me, and being under the knife with her for 12 hours was something that I needed to feel comfortable with. And so she definitely gave me that comfort level where I knew that I'd wake up and be happy with my results. The best part of coming to Dr. Fisher's office is the entire staff is very friendly, very caring, able and willing to answer every question. And overall, it's a comfortable office to come to. It's not uptight. It's not stuffy. You do not feel like a patient. You generally feel like you're coming to visit a friend. I would recommend Dr. Fisher to anyone I would come in contact with. She's the best in town.
Well, it's really nice of you.
It's true.
Thank you.